Hello, I'm Arik Korman, Communications Director at League of Education Voters. Welcome to our free online webinar series, Lunchtime LEVinars. We started this series 5 years ago to share information and build knowledge on important and timely issues. Today's webinar is on how to implement mental health supports in schools. In order to learn, students need to feel like school is a place where they are supported. A key component is providing reliable and consistent access to mental health services for students through either staff or third-party providers in every school building. Our speakers today are Arik Bruns and Kelsey Schmitz from the University of Washington's School Mental Health Assessment, Research and Training Center, also known as the SMART Center. They will describe how to encourage and enable school districts to create positive, supportive school climates by implementing a system of specific and tailored supports to identify and meet student needs. They will also answer your questions. Arik Bruns is a professor in the Department of Psychiatry and Behavioral Sciences at the University of Washington and Associate Director of the University of Washington's School Mental Health Assessment and Research, or SMART Center. He has conducted several federally funded research studies on how to ensure the quality, efficiency, and effectiveness of school mental health services, and also manages the SMART Center's Technical Assistance and Training Corps. Kelsey Schmitz is the MTSS, which is Multi-Tiered Systems of Support, and School Mental Health Training and Technical Assistance Specialist at the SMART Center. She leads the School Mental Health Supplement that is part of the Substance Abuse and Mental Health Services Administration, or SAMHSA-funded Northwest Mental Health Technology Transfer Center that covers SAMHSA's region 10 states of Alaska, Idaho, Oregon, and Washington. She recently joined the SMART Center from the Office of the Superintendent of Public Instruction here in Washington State, where she was leading statewide MTSS efforts. Kelsey has worked with schools and districts in Washington and Kansas to provide professional learning, coaching, and evaluation to meet the social, emotional, and behavioral needs of students within an MTSS framework. She has a master's degree in special education from the University of Kansas. A couple of housekeeping items before we begin. You'll notice that there's a Q&A function at the bottom of your screen. This is a space for you to submit questions to us. As always, feel free to send any feedback about the webinar quality to us on the chat function, which is also at the bottom of your screen, or you can email it to info@educationvoters.org. Welcome, Arik and Kelsey. The floor is yours.
Thank you so much, Arik. This is Arik here from the University of Washington SMART Center. Our mission here at the SMART Center is, in fact, explicitly and exclusively focused on the topic of today's webinar, which is to promote high-quality school mental health programming that can meet the full range of social, emotional, and behavioral needs of all students. Here's a little picture of us, at least a couple of years ago. Kelsey wasn't even with us yet, so she didn't get to be in the picture. But we are a collaborative effort of the UW School of Medicine as well as the College of Education. And it's a real pleasure and privilege to be here. I also think that it's really fantastic that you have these webinars only last a half an hour with Q&A. So we have to be quick today to make some very high-level kinds of points about what it takes to get school mental health implemented with quality, which is, again, what the SMART Center's real core focus is, doing both research on that question as well as trying to make it happen in schools locally here around the Seattle area and in Washington State as well as nationally. So a few acknowledgments. We really work closely with a whole bunch of different centers and wonderful people who've contributed to this content today, including Lucille Eber, Susan Barrett, Mark Wiest, and others who lead a national effort to interconnect mental health into the school context. We hear a lot of bad news about the state of children and adolescents today and their mental health and their well-being. And I think that although we see these statistics, it's worth repeating them as we ask, what is the purpose, what is the point, what is the relevance of school mental health services? We have seen over time that youth suicides in Washington have increased year over year for some time. To the point where we had over 80 youth suicides in our state last year of school-age youth. We also see that youth are expressing in surveys that their feelings about their suicidal feelings are also on the uptake. We have the Healthy Youth Survey data that's collected every 2 years that shines a light on just how broad-based this problem is. And underlying all of that, of course, a lot of anxiety and depression, whereby over half of all students say that they have had those kinds of troubling thoughts in the last 30 days. Fortunately, we have an opportunity through our education system, if we can support it and do it well, which is going to be the focus of the next 15 minutes of our presentation, to play a major role through school mental health in promoting the emotional wellness of our children and youth. We know that despite the great need that's also increasing, most youth who require mental health services do not receive them. Accessing services from community clinics is something that does not happen very consistently, and when kids even are connected with a community-based counselor, more than half the time they disengage before treatment is completed. So it's not surprising then that school mental health accounts for the majority of all mental health services received by young people in our country. And the other thing is that because it's available where kids are day in and day out, and often has ways of trying to meet the needs of all kids, it can improve service access for underserved youth. Moreover, social emotional learning programs for all students school-wide have been shown, when implemented well, to be able to improve school achievement. When we talk about emotional behavioral problems in students, we're talking about trying to intervene early to, as the previous slide suggested, with social emotional learning, school-wide positive behavior structures. When it comes to what we're trying to prevent or intervene with early, we're talking about a small number of types of problems that we do have evidence-based practices for out there in the world that we can do in schools to address two broad bands of problems. One being externalizing problems, such as conduct problems, behavior problems, as well as attention deficit hyperactivity disorder, and internalizing problems, which the main categories of which are anxiety, depression, and the sequela of past trauma. So when we talk about what we're trying to prevent or intervene with, these are the major classes of problem areas that we're going to be seeking solutions for across, again, prevention and school-wide strategies all the way up to intensive interventions, whether they're individual or group-based. So when we are attempting to build such school mental health structures in our schools or in our districts, or statewide for that matter, as many states have done, the advantages here are that we can improve access to services, early identification, and reduce barriers to learning, which means that kids' at school achievement and attendance improves, which we have seen in research also means that their social and emotional wellness improves. Kids who experience success at school also tend to experience improved mental health functioning. But we need to do these things well to actually achieve the promise. Same thing with something I'm sure many of you have heard of, which is PBIS, or Positive Behavior Intervention and Supports. It's in about a quarter of all of our schools, a decision-making framework, again, a whole school approach to guide selection and implementation of best practices to reduce discipline problems in schools and improve school climate and mental health of students. But again, it needs to be done well to achieve the outcomes that research has shown that PBIS can confer, such as promoting effective decision-making, reducing punitive approaches, and improving student academic performance. So how do we do things like PBIS and school mental health with quality so the outcomes can actually be achieved? As Kelsey is about to describe in a minute, we need well-accepted implementation structures to fit those evidence-based strategies across all three tiers of intervention, from prevention to intensive intervention. We also need those structures to include certain core features, such as systematic screening of students. Like I said, tier 1 universal strategies that can help prevent the bubbling up of problems for kids and thus reduce the degree to which we have to be putting out fires. Instead, we can prevent those problems before they start. We need training and support for the school staff and sometimes community providers who come into schools to do tier 2 to 3 interventions, whether it's group or individual. And to achieve those things, we also need things like district community leadership teams, good quality monitoring and quality improvement approaches, and as we'll conclude this webinar with a plea to support the quest to fund all of the above to fill gaps. This is a quest that we are undertaking very assiduously at the UW Smart Center. District funds and Medicaid funds are not enough to make this work. I'll hand it over to Kelsey to talk a little bit about those structures that are so critical.
Hi, it's great to see so many of you on, and as Arik said, it's great to have the opportunity to share some information with you all. I recognize that not all of you may work in school settings. Some of you may be community providers. We may also have some family members attending. So I appreciate the modeling that happened in the beginning around acronyms. So we'll try to spell things out if we have any acronyms that pop up. Something that's important to remember is that we can't intervene ourselves out of a poorly implemented or underdeveloped or non-existent system, for that matter, to support students. We really feel that kids should get support by design and not by chance. It is way more effective to prevent problems or detect them early rather than to treat them as they pop up, as we can see illustrated here by one of my son's favorite games at the carnival, which is whack-a-mole. Many skip developing the system, and without the system, we end up playing this endless game of whack-a-mole where we're reacting to problems as they emerge. So Arik talked about positive behavioral interventions and supports, and I know there are many schools in Washington and across the nation that are implementing these, positive PBIS. It's been implemented on a scale of social significance and has many benefits, as Arik mentioned. So you can go ahead and click through all the animations there. Many schools that are implementing PBIS, however, struggle to implement effective interventions at Tier 2 and 3, and also struggle to align multiple initiatives. There's been some research that on average, schools are implementing up to 14 initiatives and haven't done the work to align them. Youth with internalizing issues may go undetected. Often if we're just looking at office disciplinary referrals, we might miss those students who have internalizing issues, who may be withdrawn, depressed, have high anxiety. So I know a lot of schools are moving towards calling their office disciplinary referrals, renaming them to time out of class, so we can capture things like requests to see the nurse and counseling visits and things like that. And finally, PBIS systems, although they're showing success in social climate and discipline, often don't address broader community data and mental health prevention. Next slide. So when it comes to mental health in schools, mental health providers in schools often are working parallel to one another and don't know what each other are providing to students and families. So we need community partners to be integrated. So we want to be moving from a co-located model to an integrated model where community partners are part of the Tier 1 and Tier 2 teams as well. And to do that, we need funding and support for those partners to function at those levels. And we also need clear, systematic memorandums of understandings that clarify those roles and the functions of the integrated teams. So schools that are implementing PBIS are ideal for connecting school mental health services and supports and expand the ability to address non-academic barriers to learning. In the early 2000s, some work began between two national centers, the National PBIS Center and the National Center for School Mental Health, to embed mental health evidence-based practices into PBIS. The Interconnected Systems Framework is a structure and a process for blending the strengths of school and community mental health with the strengths of the multi-tiered framework of PBIS to maximize effectiveness and efficiency. And so in this slide, you can see sort of a comparison of traditional co-located approach versus an interconnected MTSS, where the mental health person is on the teams at all tiers. We're clearly defining what interventions we're using as opposed to just seeing students at appointments and not participating or contributing their expertise at all levels. So also on this slide is where you can find information about the Interconnected Systems Framework. You can find the monograph that was written in 2013 that was highlighted on the previous slide, as well as some tools to use. If you are implementing PBIS, there's a tool called the Tiered Fidelity Inventory, and they've done a nice job in creating a companion guide that identifies the big ideas around Interconnected Systems Framework on each of those items. So multi-tiered system of supports is a system for prevention, early intervention, and support. And there was a book that was published a couple years ago by Kent McIntosh and Steve Goodman. And the way they define MTSS is that it's an integration of a number of multi-tiered systems into one coherent, strategically combined system meant to address multiple domains or content areas in education. It really involves a shift in thinking about how a system responds to students' multiple needs, and it's more than just the triangle. It represents a general framework for unifying these separate interventions. And as you can see as the animations come up, this is a system where we identify what evidence-based practices are we implementing across all tiers so that we layer up on the supports for students. And we use comprehensive screening, as Arik mentioned in the beginning, to detect students who may need more, but we're also progress monitoring those students to determine if they're receiving the supports as intended and what their outcomes are, so we can adjust those supports as needed. And when we talk about ISF, we can identify the key messages of having a single system of delivery, so investing in one set of behavioral health teams at each tier. It's important to remember that access isn't enough, so a referral is not an intervention. We need to be rigorously progress monitoring students as they receive those interventions. Another key feature is that mental health is for all. So this involves every person in the building. Mental health is everyone's job, not just those school clinicians. And finally, MTSS is essential to installing school mental health. So in this next slide, sometimes in education we use these terms and jargon, and what I like about this slide is that it really gives you in a nutshell what MTSS is. What we're doing is we're organizing our resources for students so they can get the help early. We do stuff that's likely to work. We provide the supports to staff to do it right, and we make sure that we're continuously improving those efforts. And so before I hand it off to Arik, I just want to mention that aligning initiatives should not fall to individual teachers or at the practitioner level. We need to develop these structures and processes at the district and community level to support our individual teachers and mental health practitioners.
Thank you so much, Kelsey. So we're going to hand it over to Arik in 1 minute to see what kind of questions arise, which will probably be the most interesting part of this half an hour we have together. Hope you've been enjoying your lunch. But before we do that, just to kind of reinforce, since this is the League of Education Voters, that we at the Smart Center and many other advocates really do see priorities for Washington State that align with the kinds of system structures and needs that Kelsey just described that are required to make school mental health and PBIS effective in our schools. We need to fund school mental health in this state. It cannot be done simply through, again, existing resources at the district or school level or by reimbursing Medicaid or insurance. Those provide barriers to effective school mental health. And second, we need to support a system, as Kelsey was describing, something that actually provides a structure and quality monitoring statewide for high quality implementation of school mental health through that MTSS framework, as well as consistently available training and coaching. What we would hope is that going into the weeds just a little bit, that what we do is, again, recommendations that we put out there for legislators and advocates and others, exert upward accountability towards these kinds of goals. fund school mental health. Once again, a goal of at least one mental health provider in every school working within those structures. But we also want to make sure we're building a strong state level initiative for school mental health, where there are state folks who are leading the charge towards this kind of consistent structure. A shared agenda that brings education as well as mental health, family advocacy, and other youth serving systems together to say, how can we do this all together and not, again, just put it on schools or mental health providers to figure it out. Move towards standardization of services by having memoranda of agreement with our providers so that they understand what their role has to be in a well-functioning MTSS and school mental health structure. Develop strong infrastructure for training and coaching as well as accountability. And finally, make sure that we are emphasizing this structure, this multi-tiered systems of supports as the foundation. And as you'll see, it's worth repeating at the very end that we need to be advocating for funding for school mental health with the goal of one or more mental health providers in every school, supported with training, coaching, and monitoring for quality. And with that, we'll hand it to Arik to tell us what kind of questions have arisen.
All right, great. Well, thank you so much, Arik and Kelsey. I really appreciate it. And now we do have about 10 minutes of questions. So for those of you who are listening, please type your questions in the Q&A feature that's at the bottom of your screen. No question is too basic. And so I will start with this one, which is, what would mental health services in Tier 1 look like if there was an external mental health provider involved within the school?
I'm sorry, can you say that one more time, Arik? It went by so fast, and I was looking at the questions in the pane. I'm sorry.
Yeah, no problem. So what would mental health services in Tier 1 look like if the services are being provided by an external provider in the school?
Right, it's a great question. I think Kelsey probably has some practical ideas about how this can work. But just, I think that one of the most important things is that when we bring external resources into school, that, like Kelsey said, they're not folks who are, as was the case when I was a 24-year-old intern and clinical psychology intern, you're just put into an office to see kids. These individuals ideally understand the array of resources that are available both in the school as well as in the community so that they can serve a triage role. They're serving on school-based teams, and they have roles in the mental health supports and services across all three tiers. It could very well be that this clinician is a resource that's looked to not just for individual treatment, but also for running groups, for designing and implementing and supporting the rollout of social emotional learning programs, for advising around how screening will be done and identifying the students who are, liaisoning with the students that are being identified by teachers as potentially needing help. They need to serve on those teams at all those three tiers and be an active part of the solutions that each building comes up with. What do you think, Kelsey?
I think that's a great answer, and I would just add that adding that expertise at the Tier 1 level, so you have somebody with that lens and experience to be looking at your school-wide data, your maybe your office disciplinary referral data or your screening data, who could make recommendations for those school-wide Tier 1 interventions, which might include a social emotional learning curriculum, are things that mental health provider can offer at the Tier 1 level.
Right. We would love that provider to be the source of expertise when the school says, we do need more attention to prevention, to positive behavior supports, to social emotional learning programs. And that provider ideally will be looking to find the best resources that meet the school's needs as an expert in the field, because that probably in the end will serve better dividends than simply waiting for kids to show up at Tier 3 in their office.
Great, thank you very much. So we have a question here that says, I have a son who is both homicidal and suicidal and made a clear threat against our local school, has had 3 mental health holds, and is now waiting on a CLIP placement. And I don't know what that acronym stands for, but you might.
Children's Long-Term Inpatient.
Got it. Thank you. Our local school has not been supportive, even with warning and asking for support. How do we get our local school to implement such a program like PBIS?
Kelsey, you want to start with that one?
Well, yeah, so there's some information, and feel free to reach out to Arik and I afterwards, because we'd be happy to provide some information that you can use that's already been developed to communicate the benefits of PBIS to your school administrator. We also feel that it's really important that PBIS be implemented at the district level, especially when it comes to needing those Tier 2 and Tier 3 resources. It's important to have that district level involvement. There is a current school climate transformation grant that Washington was just recently awarded, and through that we'll be providing free training and support to about 30 districts across the state. So we could check to see if your school is one of the recipients of those, and if not, help connect your school or district to those experts in our state and region that provide PBIS training.
Yeah, I'll leave it at that, since we do seem to have some other questions as well. Thank you, Kelsey.
Great. Yes, we do have another one, which is, how do you overcome the barrier of local control in each school district? Specifically, the Office of the Superintendent of Public Instruction has been reluctant to establish funded mandates to implement PBIS or mental health in schools statewide. This creates competition in neighboring districts for resources. It also creates inequity for districts that are able to provide funding for support.
Yeah, it's a great question. Kelsey might have some perspectives as well as a prior OSPI employee, but I think that at a broad level, there are states that have invested $15–20 million annually to ensure that equity does exist. And in fact, sometimes they take an approach that tries to prioritize schools with the greater level of need for funding. So for instance, in Maryland, schools that had the highest level of disproportionality and discipline, as well as discipline overall, were those that had PBIS as an expectation and for which resources were available to do PBIS. I think this is the kind of thing that can be addressed through legislation. It can be addressed through political will that combines different sources of funds across child-serving agencies, philanthropy, other sources, and then central mechanisms ideally are finding ways to put an accountability structure in place along with resources to try to advance this in a way that is open to all districts and not just to those that might have the greatest amount of resources to begin with. What are your thoughts, Kelsey?
Yeah, I think I would go back to the School Climate Transformation Grant. The goal of that grant is to build state level capacity for providing supports for PBIS. So I know that it is something that OSPI is committed to building state trainers and state coaches and a network of people who can support buildings and districts.
Great, thank you very much. We've got time for about a couple more questions. And here's one that's more focused on the-ground implementation, which is, how can schools encourage students to continue receiving mental health services if the students don't show up for counseling appointments?
It's a tough one. I mean, we hope that there will be methods to engage students using evidence-based techniques, but I think there's also this issue of any good interventionist is really aware of the array of different options and is able to kind of deploy their clinical skills as well as some evidence-based techniques to trying to figure out what's the best fit between what the student says his or her needs are and what might be available out there. It may very well be that a practitioner has to accept that this student may not be feeling the relationship or the model of an individual or whatever first attempt was at help, and be able to problem solve with that student about employ some motivational interviewing techniques perhaps about what they are interested in addressing in their life and fit them to the best kind of help. Again, if you have a kind of a system of supports and an understanding about how the provider fits within community and school-based resources and good knowledge of those resources along with clinical skills, that would be the kind of outcome that you're hoping to achieve with students that are difficult to engage. But it is a tough nut to crack with any individual student or kid.
Yeah, thanks so much. Here's a question that I think was interesting, which is, do you have ideas of how to integrate therapy animals, for example, dogs, into MTSS, especially with the issue that some districts have no pet policies?
Well, I might hand that one to Kelsey.
Wow, that is an interesting question. I can't say that I have a great answer for that other than, part of the MTSS process is, identifying what the students' needs are and then matching those needs to supports. So, you might be able to come at it from that angle and being clear about identifying the need and how that intervention or support would meet the students' needs.
Great, thank you. And we've got time for just actually two more. One that I think is really important, and then kind of a high-level one at the end. So this one is, I've heard from some community providers that some students and families don't trust schools' ability to provide mental health services effectively or confidentially. What can school leaders do to build the community's trust in the educational system as a hub for mental health services?
It's interesting that comes from the community providers. I'm wondering if there's some differentiation between clinic-based services and school-based services that the community providers that this individual has heard from. So it's kind of an interesting question. Ideally, we've got the same kinds of confidentiality, and legally, you have to have the same kinds of confidentiality expectations in place for school mental health as in the community. But I can understand how there might be, some conflation of what the typical communication and information sharing is in schools that might spill over into people's thoughts about how school mental health practitioners might operate. Again, if you've got a community provider, whether they're well embedded or not, working in a school, they are going to be held to the same standards. And I think that those are the kinds of messages that need to be delivered. We've seen a lot of hesitance on the part of some communities to invest in these kinds of strategies, school mental health, school-based health centers, and so forth. And, one of the key things is just to make sure that there's a lot of good, transparent information that's available about the realities of these kinds of things, confidentiality, the nature of the services that are available, being really straight about our state's consent to treat law and how where the age of consent is for treatment and so forth, and how that is likely to interact with students and practitioners in schools. But making that stuff available is often not something that school and district leaders find the time to do because they have so many things on their plate. But being really clear about what schools are attempting to achieve for parents' information and the community providers as well, I think is a big starting point.
And I would just add something short to that, which is ensuring that there are families and youth that are participating on the teams that develop these systems, so we can be addressing these issues and considering these things from the very beginning as we're building these systems.
Great, thank you. All right, last question, which is, how are you advocating at the state level for mental health services? I know that you touched upon discussing the issue with legislators, but is there other levers that we should be aware of?
Yeah, it's a great question. It's something that we and a lot of colleagues have been trying to make progress on with legislators. It takes a lot of different prongs of effort that, again, is difficult sometimes to carve out time for, but it's such a critical issue that we feel like it's worth it. We're trying to work individual legislators to help them become aware of the fact that this is actually not adequately funded at all. There are not resources available in schools. The community providers that are coming in are often kind of beholden to their kind of clinic-based approaches to doing things. Not that that's bad, but it's only one kind of service that often is being provided. So there's a lot of education that's needed to individual legislators. And also we are trying to work with groups like the Children's Mental Health Subcommittee of the legislature to advance some of these ideas. What you see in the PowerPoint deck we just went through is often it kind of summarizes our cornerstones of what we're trying to get legislators to understand, which is that this is worth investing in. It's not being done consistently currently in Washington or anywhere for that matter, but we could do so much better with some really thoughtfully allocated and equitably allocated, transparently allocated resource, along with support for implementation in the state.
Yeah, thank you. Just have a comment here at the end, which is, yes, family and youth engagement can't be an afterthought. It has to be in partnership if there's any hope for this work to be sustainable over time. And I thought that was a great note to end on. And Arik and Kelsey, thank you so much for the wonderful presentation and for taking our questions. We really, really appreciate it.
Thanks so much for having us. We welcome people to reach out if they have additional questions or need some additional resources.
Great. Our next webinar will take place in early July and will focus on impacts of the 2019 legislative session on education funding. We'll post our information on the website soon, which is educationvoters.org, and share on our social media channels. Thank you to each of you for joining us today. If you have additional questions or comments, please send them to Arik, spelled A-R-I-K, @educationvoters.org. A recording of today's presentation will be available on our website, educationvoters.org. Feel free to share it with your friends and colleagues. If you would like to learn more about League of Education Voters or support our work, please visit our website, educationvoters.org. Thank you again for attending. We hope that you will join us at future webinars.